be doing my IV push and IV piggyback competency in the same video. So first, on my competency, I'm going to check my MAR to my orders, and my orders, I'm going to check my patient's name. I'm going to check and see if they have any allergies. They do not have any allergies. We're going to, on both of them it says we're going to give morphine 2.5 milligrams, IV push, and we're also going to give Zantac 50 milligrams IV piggyback every 8 hours. So on both of these I'm checking my medication, my route, my time, and my dosage. I'm checking both of those on my orders and my MAR. Next I'm going to compare my medications with my MAR. Make sure, give me morphine. Make sure that matches up, and then also my Zantac with my MAR. Then I'm going to check and make sure I have a safe dose and my time administration and my rate. So for morphine, we're giving 2.5 milligrams. For IV injection, it recommends an initial dose of 2 to 10 milligrams per 70 kilograms of body weight, and so that's a safe dose. We can give it undiluted, but we are going to dilute it in normal saline, which is compatible with, and it's also compatible with our normal saline that's infusing, just to make the push a little easier to administer. We also need to give our morphine over 4 to 5 minutes for our administration rate. And what we want to look at with our precautions for morphine is respiratory depression, and we want to watch the vital signs, making sure they're breathing fine. On our Zantac, we are given 50 milligrams in a 50 milliliter bag, and for intermittent infusion it's safe to give 50 milligrams every 6 to 8 hours, so our dose is safe. Each vial containing 50 milligrams must be diluted. That's for injection. For infusion, they're pre-mixed in 50 milliliters, so ours is pre-mixed, and it's pre-mixed in sodium chloride, so it's compatible with our fluids. Our rate is going to be 50 milligrams. It should be infused over 15 to 20 minutes. We're going to give it over 20 minutes. And any precautions with that is just hypersensitivity, any allergic reactions, and things like that. So I compared all my stuff, checked to make sure they're good in the book. I'm ready to prepare my medications. So I go in, med room, wash my hands, put my gloves on. So for morphine, we're going to be drawing up 0.6 milliliters to get our 2.5 milligrams, but we're going to dilute it up to 1 milliliter, so I'm going to have 0.4 milliliters of normal saline. I'm going to clean both my tops. Scrub this for 15 to 30 seconds. Scrub dilution 15 to 30 seconds. Pull back my 0.4 milliliters. Draw out my dilution first. It's 0.4.
Yep.
Now we're gonna draw up our morphine, and we need 0.6 of this, so to our 0.4 we get a total of 1 milliliter. We just want to pull straight back. All the way to 1 milliliter. You can see that's 1 milliliter in all. And then I recap my syringe. Now I label this morphine, 2.5 milligrams, my medication and my dose. Okay. We have our morphine drawn up. Now we're gonna get our piggyback ready. Go ahead and clamp that off. Pull my top of my piggyback. Fill that up a little bit. Now I'm gonna prime my line. Screw this a little bit.
Make sure the primer has no bubbles.
Okay, there's no air bubbles in my line. I got it clamped off. Now I'm gonna label my Zantac. And I'm also given 50 milligrams of that. So let me do this on here where I can write it down. Put that on my bag. Alright, so I have both my medications, all my equipment I need before I go in the room. So I go to my patient's room, I'd rewash my hands, I'd put on gloves before I administer my medications. I would identify my patient with the 2 patient identifiers, his name and date of birth. I would again check for allergies just to make sure. I would explain the procedure. We're giving him an IV push, which we will give through a syringe. We will push it straight into his IV line. We're also going to give him a medication that we're going to hang that will go through his infusion as a piggyback. We're telling him we're giving him morphine, which should help with his pain. We're also giving him Zantac, which should help with some of his gastric pain or his GERD. So after that, I've explained that to the patient, check my patient's name and his allergies. I'm ready to give the medication. Take this off. I got some sticky stuff on these gloves. So when I'm giving IV push, before I do that, I want to check and make sure my line is patent. So I'm checking and making sure there's no redness or irritation or infiltration at the IV site. I'm also going to unclamp. Drop this below my site. Make sure I have blood return. I do have blood return, so my line is good. So this is compatible with my morphine. First, I would clean the port. I'm going to administer in the port closest to the IV line, or IV catheter. Clean that for 15 to 30 seconds. Scrub the hub. And we want to give morphine over 4 to 5 minutes. So I'm going to be given 0.25 milliliters a minute. So we're going to give this over 4 minutes. So we have 1 milliliter. We'll pinch it off, give our 2.5, unclamp, let the fluids flush it. We'll wait a whole minute. I'll clamp it off again. Push another 0.25 milliliters. Unpinch, let it flush, wait a whole minute, pinch it again, 0.25 milliliters, unclamp, let the line flush, wait a whole minute, clamp again, flush my last 0.25, unclamp, let it flush. We're done with the push. I would just assess my patient and make sure he didn't have any problems or have any bad feelings at his IV site or irritation or anything like that. So next we're going to hang our IV piggyback. We know our line is infusing. We've already identified our patient. We know he doesn't have allergies to this medication. So first we want to drop our primary bag.
Watching for any signs or symptoms of reaction. Just go to the charts. Make sure there's no pain.
Our line is already primed.
As long as that's okay.
For the piggyback, we want to use the port closest to the bag.
That's it. I'm going to use
Also got to clean this port,
bag. Clean.
15 to 30 seconds.
15 seconds. Do that for 15 seconds.
I do have my piggyback line clamped right now.
Close off this primary.
Now I'm going to open up my piggyback line. Make sure there's no kinks in my tubing. I'm unclamped everywhere. Now I'm ready to set my drop rate. So for the Zantac, we're going to give him 25 drops a minute, or roughly 6.25 drops every 15 seconds. And we're going to set that with our primary line. You can do it here if you need to, it's probably easier.
Have his back fluid applying. On the regulator, using the primary line. And for this rate that we checked earlier with MAR, and the drop factor we're using is 0.5
was 22, so we're a little short.
It was a full minute. So I'm gonna readjust.
That was 26. So let me turn it down just a little bit. That about stopped it. Try for a minute again. Alright, we'll go for a minute. That was 24 on that minute. Okay, that's right at 25, 26. So we're good on the rate. So I'll leave the room since I got that hooked up and ready. I'd come back in the room later after my piggyback's done running, identify my patient again, and I would clamp my secondary bag. Take that off, throw it in the trash, rehang my primary sodium chloride. I'd reset the rate to whatever the doctor's orders were, and then I go document and make sure my patient was good and no other reactions happened during the medication administration.